Hi, everyone. It's Dr. Ozzy here. Welcome to the More Than a Pretty Face podcast. I'm back today with Lacie. We have another video episode on YouTube again. How's it going?
I know. What number is this?
I don't know. But for those of you who may be listening, you should also know now that you can watch us on More Than a Pretty Face podcast. So how's it going?
It's going good. How about you?
Good. Yeah. Is everything good with you now? Like, are you back to, sort of baseline because you guys were sick for a while, you were traveling?
Yeah. Feeling better. I still have like this random cough from COVID that's lingered on, but other than that, I'm doing good.
Good.
Yeah.
Good. So do you have a beauty and blemish?
Yes, of course I do. My beauty would be this past weekend. We went to Fiesta Island, which is a fun little beach park.
I haven't been there in so long. I used to bike around that island.
Oh, yeah. There's so many bikers. Oh, we love it there because you can have campfires and just spend the day there. So we did, and we had friends out and jet skis, and we made a whole
jet
day.
Skis. Oh, fun.
And it was fun because Remy wanted to call it the pool. So I'm teaching her ocean, and she pronounces it ocean.
Ocean.
Oh shit.
Oh shit.
Oh shit. So it's fun.
Oh, she's the best.
Yeah, she is. We had a great time with friends and spent the day there. And I guess my blemish would be not working out enough. Because let me tell you, after a day of jet skiing, I could not walk.
Oh, really?
I was so sore.
You're like, note to self, it's time to
get back in the gym. I got to figure out adding that back into my routine now. But
it's hard. I think really especially after having a baby and pregnancy, it's like, I remember with my second one, it was even harder. But for me, working out is really to clear my head. It's more, I mean, I want to be skinny, right? And I want to be
fit, healthy.
But aside from that, I think it has so many other benefits. Like if doctors, instead of prescribing medications, would prescribe exercise, even if it's 10 minutes, 15 minutes of walking around the block.
Yes.
People will feel so much better. So and true. With our lifestyle now, the way it is, being online, sitting on a desk all day, just that 20 minutes of activity, getting your heart rate up for even if you can do it for 10 minutes, it's a game changer.
Yeah.
I feel like I have some of the best ideas and like some of the best clarity when I work out.
Yeah.
But you just have to do it. It's hard. It's like one of those things. It's hard to get started, but once you get started, then it's like you can't quit.
My girlfriend says 70% of the struggle is just getting there, getting to that point and doing it. Once you do it, it's downhill from there. It's
you know
easy.
What? And an easy thing is to like set it up with a friend, at least at the beginning.
And then you have accountability.
Because you can't like cancel, right? Yeah. You're like, okay, we're going to do this.
You
could, but you're less likely to,
right.
you know? So that's great. Well, I have all the confidence that you're going to get back. And, I think it's going to be good on so many, levels. That's great.
Yeah. How about you? How was your...
So, I guess I got a chance to go to this event in LA. It was sort of a last minute thing. It was in this beautiful mansion in Bel Air, part of LA, and had this fantastic view. And it was a women's wellness event. And I never gone to anything like that. I guess with COVID, we really haven't had a chance to do something like this. And it was sponsored by Royale, which is a wellness brand for women. So they make like organic feminine care products, like pads and tampons and so forth. But they also have skincare products, and it's developed by Korean women, which I always love supporting women-owned businesses. I think it's so important to do. So we went, and it was like they had like IV drip set up in the living room. It's like I walked in thinking, only a party in LA would you have these IV hydration drips. And they had seedling. Have you heard of that?
No.
Seedling is sort of like acupuncture, but it targets the ear because pressure points in the ear is supposed to be the gateway to your body. So
like with needles?
So acupuncture is with needles, but this actually uses metal, like these little gold seedlings. They're tiny little seeds.
Oh my gosh. I noticed those in your ear this week.
Yes.
Okay.
Yes. So they put them on certain pressure points of the ear, depending on what it is that you want to achieve, whether it's, relieving anxiety or menstrual cramps or whatnot. But instead of using a needle, they literally stick this, gold, little metal thing on your ear. So I thought that was cool. I'd never heard of that before.
It looked like jewelry.
It did.
It was pretty.
Yeah. When the sunlight hits it, it kind of, shimmers and it was pretty. So it did that. Surprisingly enough, the trip was pretty seamless. Usually going up to LA, it's always like an adventure.
Yeah,
traffic wasn't horrible. But I guess when I right when we pulled up to the event, and I had never seen this in real life, I guess, witnessed it. This guy gets out of the car and spits in this other guy's face. I was like, whoa, what is going on?
What?
And then the guy in the car whacks him and we're like right behind this car witnessing this literally in front of me. And next thing I know, then the guy whacks him back and then the guy gets out of the car and I was like, oh,
a full-on fist fight in front of you.
Yes.
Was this in the middle of the street
or was like a guy in his 50s or 60s and then with this other guy who was in his 30s? I was like, what is going on? They had a full-on fist fight in the middle of the day in this like upscale neighborhood of Bel Air. And I was so scared because you never know now.
Guns or anything. Yeah,
you never know. Somebody goes to their car and they're going to pull out a gun. And next thing I know, I was like,
a bystander.
Yeah. I was like, please don't get any closer to them. Yeah, so it was pretty gnarly.
Was very eventful.
Very eventful. And I was just like, oh my God, what if they die? Because they were hitting each other really hard. And I've never really witnessed a full-on fist fight between grown men. And it just kind of made me think, boys. I mean, look at these men. They're grown men. And they literally fist fought for 5 minutes and then got in their car and drove away.
Oh my gosh.
I was like, what was the point of that? Like, what was the point of that? Because then people started honking, like, get out of here. You're holding up the cars. Bizarre.
I don't know what I would have done. That is insane.
So the whole event was centered around menstrual phases.
Awesome.
So they had one room dedicated to the, menstruation room. And that was where they had the seedlings. They had like one room dedicated to follicular phase. And that was when you had the, ovulation or the IV hydration drips. So yeah, it was pretty cool.
Oh my gosh.
What a concept.
That sounds like an amazing topic for today.
Yeah.
But before we get started, you guys don't forget to rate, review, and subscribe. And follow us on Instagram at More Than a Pretty Face Podcast. And don't forget to DM us your questions because we love hearing from you. And let's get back to the follicular and all the phases. You said how many phases are there?
So there are 4 phases of your menstrual cycle. And I don't think that women really understand how those hormonal shifts can affect your skin. Because a lot of people think, well, I have hormonal acne. I must have something wrong with my hormones.
Right.
But really, it's not always that. It's how your hormones fluctuate throughout your cycle that can affect your skin.
This is
and
so
your
good.
mood and, a lot of other things. But for me, my scope being the skin. So a lot of times it's not that your hormones are abnormal. It's the changes in your hormones, the shifts that can wreak havoc on the skin. It's almost like, a stop and go. And here you are, stop. And then all of a sudden you're like running, then you're like plummeting, then you're, all these changes. In some people, their skin's really sensitive and it can be sensitive to those hormonal changes.
This is such a popular question, not just in dermatology, but even when I was in women's health. So many women, girls, women suffer from hormonal acne or just acne in general that fluctuates. So I love this topic.
Yes. And with hormonal acne, we really see it along the jawline, the chin, the neck area. I mean, I've suffered from hormonal acne for 5 years and have been on spironolactone, can't get off of it because every time I try to get off of it, it comes back. But I used to get big cysts like around my ears. So, it is a really big struggle for people. Hi everyone, it's Dr. Ozzy here. Happy September. Fall is almost here, and so is the time to transition your skincare routine from summer to fall. For our podcast listeners only, we're offering 20% off our best-selling moisturizers, Intense Recovery Complex and Restore. Get your moisturizer in time for the upcoming season with our limited time promo. Take 20% off at checkout on AziMDSkincare.com with code September20. I love to see your skin transformations, so tag me in your stories and posts on Instagram at Skin by Dr. Ozzy and show me your skin transformations with AziMD Skincare.
Well, let's talk about what that means. What does your skin do if you have too much estrogen?
Yeah, so basics, right? So let's talk about the different phases. So the menstruation is usually, 1 to 6 days, and that's when you bleed, right? That's the menstruation phase. And at that point, your hormones are sort of flat and low. There's not much going on. And then once you stop bleeding, you start what's called the follicular phase. In the follicular phase, this is when you see the estrogen rise up. It peaks during the follicular phase, right before you ovulate. This is the glow. You hear about the pregnancy glow because your estrogen is up. Estrogen is like the skin's secret weapon. It is the hormone that enhances your cell renewal, which means your skin cells go through the, layers of the skin more efficiently, more effectively. And what cellular renewal does is it boosts collagen. It also makes it less likely for your skin to clog. It's kind of like what Retin-A does.
Retin-A, I was just thinking that.
Cellular, it's like your body's natural Retin-A. And so during this phase, your skin's glowing, your collagen's being boosted, your fat cells are sort of plump and, really happy. Your skin looks amazing. And there's not as much of a need to do things like exfoliate because your body's kind of doing that exfoliation on its own, because that's what exfoliation does, is it helps renew your skin cells. But it's a great idea to exfoliate because you're only going to enhance those results. So people feel like, well, I don't really need to do skincare during this phase because, my estrogen's great and my skin's looking great. Wrong. I think it's still a great idea.
Just maximize.
Maximize. And, the key is to just stay with a consistent skincare routine throughout your cycle so that as these hormonal changes are happening and shifting, your skin sort of just cruising along. It's, you're keeping it at bay, you're keeping it, toned and moisturized, and you're keeping your skin barrier happy. And it's less likely to, lead to these, be affected by these fluctuations. So I digress. So that's follicular phase. And then you have ovulation. That's when the egg gets released from the ovary. And this is when you start to see, heading into the luteal phase. This is the phase where progesterone rises, the estrogen falls, which means now your skin cells are lazier, right? They're not renewing as fast. So they're going to cause the skin to get more clogged, more easily clogged. And then progesterone is similar to like the male hormone, testosterone. So it revs up oil production. So now you're throwing more oil into the mix. And that's why people tend to break out a week or two before their period because they're in that luteal phase. They've now, passed the follicular phase, the healthy glow phase. So if you notice, if you're looking in the mirror and you're like, damn, I look so good today. This and that, you might be in the follicular phase. And then the next week you're like wearing the same thing, you got the same thing going on. And you're like, oh, why do I look so god awful? And obviously your emotions are kind of plummeted too, because when the follicular phase, you're happy, you've got all these great ideas, you have high energy. And as you're heading into the luteal phase, right before you start bleeding, that's when things start to plummet, including your mood.
Yes.
So women also tend to be harder on themselves. But they're not imagining it. Their skin is also not as vibrant and as glowing.
Just like dull.
Mm-hmm. It's dull, And then people ask, well, what happens when you go on birth control pills?
That is a popular question. Yeah. And which birth control and what helps with their acne. Yeah.
That's right. Yeah. So birth control pills just takes the hormonal shifts and just makes it one level.
One level.
So now instead of all this up and down with the estrogen and the progesterone and all that, it just sort of stabilizes it. Mm-hmm. And so that's the benefit if you're really affected by
when
that.
You're on the blank pills, the placebo pills of the birth control, then you're going to spike in your hormones or no?
No. Then you just withdraw, that progesterone and the estrogen, and that's when your uterine lining will start to come off because the hormones are no longer there to keep them, maintained. Now you can just skip those sugar pills and just keep going with the hormones. And so it helps people when you're prone to hormonal acne. Sometimes birth control pills really helps. Now, it really depends on the progesterone, whether a hormonal acne responds well or not to birth control pills. Because some birth control pills are great for mood, for cramps, that sort of thing. A lot of times those birth control pills, unfortunately, their progesterone is very similar to androgens or testosterone or the male hormones. And unfortunately, those are the ones that lead to more breakouts, right? Whereas the progesterone that is anti-androgen, like the ones that are in Yaz and Yasmin, those are very similar to spironolactone, which is great for hormonal acne. Yeah. So those progesterones are less likely to cause breakouts because they tend to block the male hormones and not really act on those receptors that cause acne.
Yes.
Does that make sense?
Yes, I love it. Now, just to clarify, you guys should check with your GYN to see what's best for you and how to take it. But
so birth control pills Yasmin, we talked about orthotricycline low.
I was just going to say, what about the low lows, the low
lows? Yeah, the low estrals. Those are great, but your GYN should know which ones are better for mood, which ones are better for, hormonal acne. But, all that aside, we're also unique and you could still have trouble. It could still go the opposite way for some people.
Yes. What about those in menopause?
Yeah, that's a good question. Menopause is when, as your body ages, your ovaries age. And so your ovaries are not producing the same level of hormones as they've been. So everything starts to slow down, including hormone production. And a lot of people think, okay, I'm going to wait, because usually menopause happens for most women, the average age is 51. But perimenopause starts in your 30s and 40s. Mm-hmm. And so you start to see the hormones start to decline way before you go into menopause. And that can affect your skin significantly because remember, with the skin and estrogen, it helps keep the fat cells plump, which helps keep the skin lifted. It definitely affects collagen. So as your estrogen goes down, your collagen production slows down.
Your cell renewal.
Your skin might become more dry because the estrogen, the hormones aren't what they were.
A lot of things become dry.
Yeah. Then you can also get vaginal, dryness and so forth. So really perimenopause is the precursor to the big, M word, which nobody wants to talk about. So you could have irregular periods. You could go a few months without your periods. So those are signs that your body is approaching menopause. Yeah. And I feel that you should consider starting on hormones if you can. Not everybody can. Right. Everybody's, unique. Some people, it's just not an option for them. Maybe they've had, breast cancer. Maybe they have a strong family history of breast cancer, a strong family history of stroke. So it's really very customized. You have to talk to your doctor and see if it's really, truly right for you. But if you are a candidate, don't wait until you're 51.
No.
You want to start it earlier. Now, you may notice some hot flashes, where you just kind of wake up and you're just drenched in sweat. Again, that's a sign that your hormonal shifts are happening. You may be irritable, anxious. People talk about this brain fog.
Oh, yes.
Which is true because as your estrogen drops, well, it can definitely affect people in different ways. But those hormonal shifts should be addressed sooner rather than later.
Yeah, absolutely.
So let's talk about some things because I get this question a lot too. And I don't know when you were working in GYN if you got this, but foods, because some people can't take hormones, but what can you supplement with if you can't take hormones?
Right.
A big one is black cohosh. Have you heard of black cohosh?
Yep, we would recommend it all the time.
It's one of the most well-studied supplements that's out there, and several studies have actually found it to be really helpful with hot flashes in women. And when they compare it to placebo. Now, one caveat is if you do have liver issues or, liver enzymes, you may not want to proceed with it, but always talk to your doctor. Even if it's a supplement, it could still interact with your medications and so forth. So it's always good to check with your doctor. Another...
even your pharmacist.
Or your pharmacist, flaxseed oil or flax seeds are also great.
Yep.
They help with night sweats. As we talked about the skin, but let's talk about the bone.
Yes.
Because estrogen is so protective of our bones.
Yes. So a lot of patients being prone to osteoarthritis and osteoporosis and even early vitamin Ds.
That's right. Yeah. So getting some natural sunlight really helps with menopause, not just, with calcium absorption, but also just your mood. It really helps with that. And I'll probably be the only dermatologist that tells you this, but sunlight actually is UVB rays in particular are particularly helpful for inflammatory skin conditions like eczema and acne and psoriasis.
Yep.
Now, I'm not saying go out and lay out, but it does help some of those skin conditions. So what other, do you have any particular supplements that you've...
We just always recommend, a good multivitamin
like a woman's...
that is high with your vitamin Ds, your vitamin D3s.
So wild yams,
because I feel like there was something else that I wanted to touch on when you were telling the other supplements, and there was one that I was thinking of, and now I just drew a blank on it. Darn it!
So you may have heard of St. John's Wort.
Yes.
Is that the one?
That is.
That's a popular one. Be careful with that one because that interacts with a lot of medications. If you're on that, I wouldn't start that, but it really does help with mood swings, particularly anxiety, depression. So these are just natural, ingredients that you can supplement your diet with, but they do have interactions.
And so many patients, so many people don't realize that. They're just like, oh, well, it's a supplement. It's over the counter. No big deal. I'm not even going to list it for my doctor to know that I'm on it. And you really should. You really should. It's not just prescription medications that we need to know about.
Yeah.
It's the supplements too.
Yeah. And then ginseng too.
Yes.
Yeah. That also it helps with mood and sleep. So that's the other thing with menopause is a lot of people's sleep gets disturbed.
Restless, very
so
restless.
It becomes a cycle, right? So you're not sleeping. So that can lead to anxiety, depression, brain fog, and those things can make sleeping worse, right? Depression, anxiety make sleeping worse. So it can become this vicious cycle. But you're not alone. There's so many women that suffer with this when you bring it up as a topic. Even things like vaginal dryness or, painful intercourse. All these things are real symptoms that are not like your fault, but they have to do with your internal sort of hormonal climate, and there are treatments for them.
There are so many treatments and so many new things out now that it's just amazing.
So my recommendation would be, if as you're heading into perimenopause, start on a retinoid. So I love Lift and Renew because it is a retinol, but it also has bakuchiol in it, which is very hydrating. I almost feel like when I use it, I don't need a moisturizer.
No, it's my favorite. Yeah. I feel like I've done nothing but preach about the Glow Serum and Lift and Renew this whole year because that's all I'm using other than the BB cream.
Yeah.
And I've been getting so many compliments, and just the way that they both feel and the way they complement each other is amazing.
Yeah, that's awesome. So it's just staying with a consistent skincare regimen, that's the best thing you can do as your skin is going through these hormonal shifts.
Yes. I was going to say, when we were just mentioning all of the issues that women go through, what's that saying that all of our problems start with men?
That is true.
I mean, I don't know who came up with that, but it sounds like they hit the nail right on the head.
They did.
What do you think about in-office procedures just to help boost collagen stimulation during that whole process?
Yeah, that's a great question because, collagen and elastin start to, go south
like
as
each
the
decade,
estrogen goes down. Yeah. But, starting in your 40s, you could do laser resurfacing. I love the halo laser. It's a non-ablative. So there's not, as much downtime as it is with like the traditional CO2 laser, but it does a great job of boosting collagen, smoothing texture, boosting elastin, and you can add PRP to a lot of your in-office treatments, particularly the ones that are resurfacing or microneedling. These are the ones that trigger your skin to make more collagen and elastin. And by adding PRP, which has all the growth factors, you're only going to enhance your results. And so I think PRP becomes even more important in your 40s, right before, that decade before menopause. And in your 50s. I mean, I always say it's better to prevent than to try to reclaim or fix. So if you can start earlier, like in your 40s, it's going to be better. Also, radiofrequency with microneedling is awesome. I've heard a lot about Morpheus 8. If you don't want something that invasive, then just microneedling on its own or radiofrequency on its own, it's going to make the treatment more gentle and I think more tolerable. And I find that there's less risk and complications when you do radiofrequency on its own and then do the microneedling on its own. There's just less of a, chance that you would get some of the complications. So those are great. And then it's also a good time to consider collagen boosting injections that we've been doing in our office for a couple of years. And the results are really great. People are really happy. We do it for the neck, the chest and décolleté area, around the knees. Those are areas that people start to notice the sagging and the thinning and that crepiness that happens. So when you start to see that, then those collagen boosting injections are great for those areas.
It wasn't until a patient just this year, she was like, I really just struggle with the laxity around my knees. And I never even thought to even notice my knees or critique my knees at all.
Yeah.
So ever since she said that to me, now all I do is look at my knees.
Well, and then hands too.
Yes.
People notice their hands.
I've always noticed my hands.
Those are areas we always pay attention to the face, but those are other areas that sort of give it away.
Yeah. So. Well, another in-office treatment too, since we were talking about vaginal dryness, painful intercourse, Exilus, we have a femme piece, and that is great.
Yeah, the Ultra 360 Femme is very, very popular, and people just love that treatment. They feel like it really enhances even their mood too.
Yeah.
And we have a whole episode that we talk about, and I can't remember what episode number it is, but we'll link it in the comments. All right. Well, I think that was a pretty good overview of hormones. What do you think?
I think this is a great episode. I think you guys will love it, but let us know.
All right, guys, thanks for tuning in. And don't forget to rate, review, and subscribe. And if you're on Instagram, take a screenshot, share it to your stories. I love to see what you're up to. And be sure to follow us on More Than a Pretty Face podcast, where you can see all the previous episodes. And we do a lot of giveaways on that site. So don't miss out. Until next time.
Bye.
Bye.